All right. Good evening. Good evening, everyone, and welcome to Atp Live Monday. Welcome, everyone. Let's try to make my big picture. All right. Okay. Good evening and welcome for those joining on Instagram. Sonia, thank you so much for joining us. Rosby, good evening and welcome. I'm just trying to make sure we pin the video and share it to all our various platforms, and then we can start. Good evening, everyone. Welcome to ATP Live Monday. I am Gbemisola Boyede, and a pediatrician, and I'll be here to answer your questions for the next 1 hour. This program is brought to you by Ask the Pediatricians Foundation. This is a program designed to support parents. So if you have any questions about the health of your children, feel free to just post your questions, and then we'll try and answer them in the next 60 minutes that we have. However, if you still have questions beyond the live section, please, you can always come to our Facebook group, Ask the Pediatricians Facebook group, and you can post your questions there. And for those of you who are watching the recorded version of this program, in other words, you are not watching live, I also want to specially welcome you, whatever time of the day you're watching. Remember that if you have any questions after you finish watching the video, because if you're watching the recording, you won't be able to ask your questions live for obvious reasons. Okay, but if you're watching recorded version and you have questions, please go to our Facebook group, and then you can post your questions there on our Facebook group. Our Facebook groups are open Mondays to Saturdays. We are not open on Sundays. For some of you that keep asking, why can't I post? Why can't I post on Sundays? That's because the group is usually closed on Sundays. So we have a day for break to rest. And so, well, Mondays to Saturdays, you can post your question any time of the day. And all of our moderators and professionals will be able to answer your questions as soon as they can. Of course, we can't answer your questions straight away. So please be patient when you post your questions. If it's an emergency, we encourage you to go to the hospital. But if it's just a knowledge, what do I do? What do I do kind of questions, you can obviously afford to wait, and we'll try and answer. But if it's a child who is sick, a child who is ill, we recommend that you take that child straight to the hospital and do not delay unnecessarily. That is where you're going to meet us and our colleagues to sort out the child's health issues. But if you just want to know, oh, how do I feed my baby? How do I make my baby healthy? What do I do in this scenario? What do I do with this? Definitely, you can leave that on our page, on our group, and we'll try and answer them as soon as we can. So thank you so much for joining me today, and we invite you to follow us on all our social media platforms, because apart from this kind of session we do live, we also do a lot of teachings on our Facebook groups as well on our social media platforms. So you can follow us on YouTube, our YouTube channel. You can follow us on Instagram, follow us on Twitter, and check out all our posts because you will learn a lot from that. You can also check our website if you want to read. Please check out our podcast. There are lots of things you want to listen on YouTube. You can watch all these videos and past videos as well. And so you'll be learning a lot. And there are lots of people that don't even need to ask questions. You just go to our group, click on the search box, either in the Facebook group or on our website, and they quickly get the answers they want. And so that's what we recommend. But of course, we welcome you to also join us live. But you can learn a lot on our platform. That's why those platforms exist. So for adult health questions, you can join us on our ATP Family Facebook group. For first-time mothers, there's FCM Facebook group. And for those who have suffered like losses of pregnancies or children, we have ATP Still a Mom group as well. So these are the 4 groups that we have trying to support parents, no matter whatever scenario you may have. So I'm just trying to share the video and try to pin it in our groups. So if you're watching me on Instagram or on our Facebook page or on YouTube, you can just drop your questions straight away under the comment section and I will try and answer them. But if you're watching on our Facebook group, you have to click on the video so that you will be able to see your questions. But those who are watching directly under the videos, I'm able to see your questions straight away from my studio here, and then I can answer them. And so please start to drop your questions. Just a few housekeeping. When you're starting your question, please always start with the age of the child. It is very important for us to know the age of the child. Please tell us relevant information only. What is relevant to the question you're asking, because I know you have a lot to tell us, but it wouldn't be easy for you to tell us the life history of the child. After a while, Facebook will cut off the rest of your comments and we won't say it. And please try and go straight to the point. Just go, what is your question? What do you want? Don't just write a lot of information and then leave it hanging. I will not know what to do with it. So tell me exactly what you want me to do, what you want me to address, what you want me to say to something. If you just give me information and you don't tell me what is the issue you want me to address, I'll be confused. And I don't like making assumptions because sometimes it can be wrong. So, and that'll be a waste of everybody's time. So just tell us exactly what you want me to do with that information you've provided. And if you're asking about the weight of your weight, for example, please tell me the birth weight, tell me the current weight. That is more helpful than telling me my child is lean, my child is losing weight. Just tell me exactly what is the weight. Then I will tell you whether it's okay or not. Your baby is preterm. Always tell me how preterm the baby was. If it was born at 20 weeks, 28 weeks is very helpful as well. I think those are the main issue for people who have questions and rashes and all that. You can't post pictures live, so because of that you have to go to the group to post your pictures, and if I don't see a picture of a rash, I won't be able to comment on it. So those are just a few things that I would like to say. And just to remind us, yesterday was the World Prematurity Day, 17th of November. Every year we celebrate the World Prematurity Day, so shout out to all the preterm babies, all our preterm warriors, all our survivors. Thank you, and we hope to improve our health services. I'll talk a little bit more about that as I go on during the course of today's program, but let me just start to answer questions. Actually, I can see a few questions on Instagram and Facebook before they disappear. All right, so Reem Done 2-3. Is it okay for an 11-day-old to sleep for 3 hours straight in the day? It is perfectly okay. So Rimdon, I guess you must be a first-time mother. Congratulations. I love first-time moms. I'm very passionate about first-time moms. I have a lot of resources for first-time mothers that you can access. So newborn babies sleep a lot. They actually sleep for up to 20 hours in the day, and you don't have any business for them to do so. They are entitled, so they just eat and sleep and sleep again. And so it's okay for them to sleep. In fact, that's a good sign that the child is eating well. So when your baby is breastfeeding well, then they will sleep up to 3 hours, then wake up to have their next feed, and then go back to sleep. So that is what is expected. And as they get older, the time begin to reduce. And then it's also not unusual for them to sleep a lot in the daytime and then be awake at night. Okay, yeah. Eventually, their sleep rhythm, what we call the circadian rhythm, will eventually change to be similar to that of the rest of the family. But that is normal. And what advice we normally give to mothers, first-time moms: sleep when your baby sleeps, so that when your baby is awake, you'll be awake. Because most of you still want to be awake during the day, and you want to sleep at night. Then the baby wants to be awake during the night, and then it's always causing a problem. So try sleep when your baby sleeps, so that you'll be strong and awake when your baby is awake. But it's perfectly normal. All right, IV star 894, a child that was born premature and fell sick. So when you're talking to a premature baby, start with the gestational age of the baby. How preterm was that baby? It is so important because we have 3 categories of preterm. We have what we call the extremely preterm babies born before 28 weeks, born less than 1 kilo, and then we have the middle ones. Those are baby born between 28 and 32 weeks, between 1 and 1.5 kilos. And then we have what we call the late preterms, those who are born after 32 weeks and born maybe closer above 1.5 kilos. So we need to have those information to be able to know which category of preterm. By inference, babies who are born very extremely preterm, less than 1 kilos, less than 28 weeks, they are the ones that are prone to most of the complications of prematurity. Babies that are born near term, near 36 weeks, 34 weeks, they are still preterms, but they are more or less not having much issues compared to the very extremely preterm babies. So that's why it's so important for us to always give us that information. All right. So, oh no, I think your question has disappeared now. So you were saying something. So, Hyphy, you have to post your question again. It has disappeared. But I know you were saying something about baby was sick at 2 years. Anyway, after 2 years old, we stop correcting. We expect babies to have, caught up with all their development and growth by 2 years. So, please. While I was busy answering that question, the rest of it has disappeared. So please come again. So Sonia said my 13 weeks, so 13-month-old seems on the weight. It weighs 9.65. I wouldn't say that is on the weight. That is normal weight for you. It's almost 10 kilos. An average 1-year-old weighs 10 kilos. Your baby is 13 months, or your baby is 1 year old, and it's weighing 9.65. It's almost 10 kilos. That is not on the weight. That is normal weight. You see why it's important for you to supplement the weight. That is normal weight. I'm not worried about that. So I would just encourage you, just keep feeding the baby. Not the baby anymore, the infant. Just make sure the child is eating well, and that's all. Make sure you deworm if you have not dewormed, and just ensure if you need more information on what to feed the child, making sure you're giving balanced diet and all that, so adequate diet like we call it now. You can check our Facebook group, go to the guide section. We have a set of videos on what we call infant feeding, to tell you what to give them, how often to feed them, what quantity to give, and all those kind of information. So you may want to make sure you're just giving the right kind of food. And I hope you're still breastfeeding as well, because we expect you to breastfeed for as long as possible, if possible 2 years. Yeah, so those are the things you can do. But otherwise, I'm not particularly worried about the weight of your 13-month-old. That's for Sonia. All right. Okay, if you say the baby was born at 7 months, so 12 months, I assume 28 weeks, was sick. She's going to be 2 years but can't walk. Is it normal? So if the child, you have to tell us the exact age. So at this age, you can't be abbreviating everything. Everything has to be exact. So there's nothing like she's going to be 2 years. How many months exactly she is, because I need to calculate her corrected age. So she's going to be 2 years. Is she 21 months? Is she 22 months? Is she 23 months? There are lots of things that we need to calculate. So for preterm babies, we need to correct their age, and we correct their age, so we have to subtract how early they were born preterms. So as long as she's not yet 2 years old, we still need to subtract it. So for example, let's assume she's 23 months, because you said she's going to be 2 years. I don't know whether it's 23 months, 2 years is 24 months. So if your baby was born at 28 weeks, she was born about 12 weeks earlier. So that is about 3 months. So we need to subtract those 3 months from it. Okay, so your baby is 1 year, 8 months. So 1 year, 8 months is 20 months old. So 20 months old, if I subtract those 3 months, so she's technically 1 year, 5 months old. So 1 year, 5 months old, who is not yet working, we are not going to worry about it, because the cutoff for working is 18 months. We will only start to worry if she's 1 year, 6 months corrected age and she's not walking. But is she standing? Is she crawling? Is she doing every other thing else, up to the walking part? Because that's the only part that you singled out. If she's doing all that, then I will not worry, because we know that we will give her a little bit more time. She says like 1 month. But if by 18 months corrected age, she's not walking, then she needs to see ideally your baby should be under a pediatrician. I hope your baby is under a pediatrician, and because all the preterm babies have to be followed up by pediatricians until they are 2 years and above. Some of us follow them up to 5 years, because we know they can have difficulties, so we need to monitor them closely. And the child is also sick. So when the child is sick, sometimes it may look as if they're developments kind of go down a little bit. So these are a lot of issues involved. So you didn't tell me what exact sickness the child also had. So I would recommend that this child should see her pediatrician, so that they can check the child's illness, whatever illness, and treat it appropriately. Then in terms of development, they need to check that development is on course. It sounds like it's on course, but if by 18 months, because it's now 1 year, 5 months corrected, if by 1 year, 6 months corrected, she's not working, we also need to see her pediatrician. In terms of what food you can give her, it's the same food you give everybody. There is no special food for preterm babies. So just like what I was talking to I think Sonia, you have to make sure you're giving them all the different food categories. So we have the we've done lots of teaching on complementary feeding, how to feed your baby and all that. I would recommend that you go through that. If you go to our Facebook group, go to the guide section. There's guide 2 on how to feed your baby, how often to feed them, quantity to feed them. You should still be breastfeeding her if you are. If not, at least you should be giving age appropriate formula. You should be doing all that. So, and that's important. You didn't tell us the weights and all that. That's also important as well, to know whether baby's weight is okay. But there's no special food. You see the same food you eat, but we need to make sure we're giving the right quantity. We are giving it in the right mix. There must be carbohydrate, there must be protein, there must be the milk, the dairy, there must be the fruits, there must be the veggies. Making sure that all of them in the right proportion, are there. All that is already addressed. It's a whole 1 hour talk teaching on its own. But if you go to our guide session, you will get all that information. But just to say, because this is also the week for prematurity, yesterday is World Prematurity Day, I really need to emphasize that all preterm babies must be followed up. I see a lot of us, once the babies are big, we're discharged from the NICU, we're discharged home. We think that's it, it's all done. No, it is not all done for preterm babies. Preterm babies have risk of, we'll call them high risk babies. They are prone to certain complications. So because of that, we need to monitor them. Your pediatrician should still be part of that child's life, minimum until they are 2 years old corrected. In fact, most pediatricians will do a developmental assessment at the 2 years corrected age to know whether the child's development has caught up with their age, or whether there's some delay, or whether they need to come to people like us, developmental pediatricians. So it is so important that preterm babies are followed up. I noticed that a lot of us in Nigeria, we tend to forget about the pediatricians once we go home. No, that is not. Usually pediatricians will give you follow-up appointments. So let's make sure we keep it. Let's make sure we always go to the hospital. So I hope that's helpful. All right. Sonia is saying your baby is still breastfeeding good. I'm happy to hear that. You're back to work. That's fine. You don't have to breastfeed every throughout the day. Your child should be on complementary feed, so you should have all the solids and all that. But whenever you are around, you can breastfeed as much as you can, and that's perfectly okay. All right. You speak to your GP about the deworming. Okay. Are you in if you are not in Nigeria, because if you say GP, I assume you're in the UK or outside Nigeria. So deworming is a Nigerian thing. There are some countries that we recommend that they deworm their children. It's not a universal thing because some countries don't have difficulties with worms and all that. But if you live in Nigeria, if you live in areas in Africa that the World Health Organization has designated warm endemic area or infected area, we routinely deworm our children from the age of 1 year and every 6 months. But if you live in some parts of the world where it is not an issue and they don't routinely deworm their children, it is perfectly okay for you not to do that. I hope that's helpful. All right, let me go to Facebook people before they section. Oh, thank God that our StreamYard is working today so I can see people's names today. Thank God for that. So, Chiamaka, what do you do when your baby holds food in the mouth and refuses to swallow it? Okay, how old is the baby? Always put the age of the baby. It's very, very important. Very, very important that you always start every question with the age of the child because it matters. So, and then what kind of food are you giving this baby? It's so important. So some children put food in their mouth, they refuse to swallow because they don't like the food, and that's just their own way of telling you I didn't like the food. And it's not a good thing for them to keep, we don't want them to choke on the food basically. So that's number one. Number two, you may want to reduce the quantity of food you put in their mouth per term at time as well. Then you may want to experiment with what the child really likes. Children will eat what they like. So if they're putting food in their mouth, it's either they are full if they've been eating it, or if they don't eat it at all, then it means that they don't like the food. And then maybe it's the way this is presented, maybe it's the way it is prepared, whatever. So you just need to experiment with that. But I need more information, Chiamaka. I need to know the age of the child. I need to know what kind of food you're putting in the mouth. This question is too generic, so it's difficult to say, to give you more specific information. So Ijama is saying my 9 months old drinks at enough water. I'm not sure. Anyway, your 9 months old drink water, takes apple, 1 banana a day. His stool is hard. So when you say your baby drinks enough water, how much water is the baby drinking? So I think let me be the judge of what is enough water. Okay. I usually prefer just tell me the information and I will be the one to judge and say, okay, that's adequate. So for your 9 months old baby, what's the weight of the child? So if the child is weighing, for example, 9 kilos, which is what I expected for a 9 kg baby, the child should take at least 900 mils of fluid a day. That is about almost a liter, of water. Not necessarily only water, whether his baby is taking things like something, anything liquid, fluid, as long as it's liquid, all together, including the water, it should be up to 900, including milk, including anything liquid, all together should be up to 900 mils or a liter a day. So that's number one. Number two, your child needs to have a lot of fiber in the diet. So half apple, 1 banana. I don't think that is enough. It's part of it, but what about the vegetables? What about the fiber? So there are other things you need to look into. Then what other food is your child eating? What is the texture of those food? Is your child taking junk food, or is your child taking other food that has fiber? So things like your veggies, especially like your leafy vegetables, your ewedu, all those kind of things, they have a lot of fiber in them, and that helps children move the bowel. They try to taking milk. If you are making milk, if you are giving cereals, how are you mixing it? Are you doing it properly? Are you giving junk food? So there are lots of other information we need. Usually for this kind of question, we want you to give us what we call it 24 hours dietary recall. It's not just for you to tell us one or two things that the child eats. What about the other things that you've not told us? It has to be a 24-hour full recall of what the child eats, and then we can say, okay, yeah, the child is happy. And it's not just for one day. Sometimes we want to know it for a whole week. It's not just I ate fruit for one day, and then what about the rest of the week? So those are the important things to tell us. So it's important for you to give us all those information. And also, if the stools are hard, then that means the child needs to still take a lot more fiber, a lot more water. And sometimes we may need to give the child a stool softener, something to for empties the bowel out, and then make sure you are doing the right thing. And if you're doing the right thing and the child is still having constipation, then you have to come to see us in the hospital, because there may be other reasons why your child is constipated. There may be medical reasons for constipation, and that we will need to figure out. Some say she stools every day, but it smells so bad. I always don't know why people talk about stool smelling. It's meant to smell, so there's no big deal about that. So yeah, so the smell is a matter of what you're putting into the child. So, but there's nothing wrong with smell. I think we worry more about the texture of the stool, whether it's hard, whether it's soft, and this kind of information. Okay, so Shamaka, your baby is 8 months old. So your 8 months old is just on complementary feeding. So I assume you are still navigating, the journey of complementary feeds. What does your child like? What does your child does not like? So if you're putting food in the child's mouth, the child is not chewing, the child is not swallowing it. It's maybe that the child does not like the food. It may be that it is cold. It's maybe that it's not in the right temperature. He's not having the right taste. So you need to explore other things. Are there other food that when you put in the child's mouth, the child will swallow that one? So you have to, but is it every food that you put in the mouth of the child that the child does not swallow? So if the child is able to take other food and not some food, then the child doesn't like this certain food and all that. So you need to experiment with what the child likes and all that. But if the child is not swallowing any food at all, then we need to check that the child doesn't have any swallowing problems. So that you have to see your pediatrician, or you may even want to see speech therapy. There are speech therapists that deal with what we call swallowing issues and all that. And then you also want to watch what texture of food are you giving. So for an 8-month-old baby, the food should be soft, it should be semi solid, it should be more porridge like, more puree like. You're not going to cause a big chunk of yam or potato for an 8 months old baby and then expect them to swallow it. So it has to be something mashed. It has to be something like porridge, like thick porridge, soft texture, purist texture. That's the texture you want to give to an 8 months old baby. You have to make sure the food is looking pleasant, colorful. Make sure there's taste, don't give them plain pap with no sugar, no dates, anything to sweeten it, and then you say baby didn't swallow it. Baby's not going to swallow it because it doesn't have taste. So these are things you need to, look into first. And then, but if you struggle, if you need more help, our dietitians can help you, your pediatrician can help you, but you can hopefully make sure you are doing the right thing first. Again, I would recommend that videos we have on feeding. Those videos, they are not many, there are about 5 or 6 of them, but they are very, very well made videos. They tell you what to give your child, how to give it, how to quantity, the frequency, the texture, all this information I'm talking about. They went into details about including your breastfeeding alongside the complementary feed. So you need to understand all that so that you can try. If you are doing all the right things and you're still struggling, then the professionals can come alongside and assist. All right. Let's continue. Instagram people, feel free to ask a question. I'm checking intermittently. So Akindele Margaret, my 7-year-old, had adenoid tonsil when it was 9 months, was removed. Okay. But it still smells, feel concerned. You can see your ENT doctors. Snoring is not always the adenoids, it's not always the tonsils. Sometimes it's just an habit, and sometimes it's just a position of the child sleeping. It doesn't mean there's anything swollen there. So we remove adenoids not because of the snoring. We remove adenoids and tonsils when they are causing obstruction to the airway, and the children is having they have what we call sleep obstructive sleep apnea. So that is when the children are having recurrent infections. So there are reasons why we remove adenoid and tonsils. It's not only because the children are snoring. We remove them when they are causing obstruction to the airway, and the children are having what we call sleep apnea, or they are getting infection all the time. When they have about 6 of it in a year, so we just take it out so the infection can stop. So it is not just about snoring. So if the child is snoring but the child does not have infections, the child is not having apnea, it's okay. I mean, that's the most important thing. So that's I've answered the question, but you can see your ENT doctors, they are the ones that took out the adenoids, so they can check for you. 9-year-old still bedwet, even when I wake him at night, reduce water intake at night, is still bedwet. So bedwetting, I think I need to do a whole talk on bedwetting. There are many issues involved in bedwetting. Number one, there are what we call an hormones that kind of reduce the amount of water that we pass out, what we call antidiuretic hormone. For some children, that hormone is not being produced enough in the brain, and so they tend to make a lot of urine at night, and then so they will pass out a lot of urine no matter what you do. Some children, I mean, no matter what you do in terms of reducing fluid and all that, that's what I meant. I'm still going to tell you the treatment. However, some children also, they are deep sleepers, so they don't tend to remember to wake up, so they go so deep in the sleep. So such children sometimes they need alarms and all that to wake them up. So those ones too may bedwise. Some children have what we call small capacity bladder. So they don't, it's not as if they're making so much urine, but because the amount of blood, their bladder is so small, it's not able to keep too much of urine. So once they get to a little bit level, then they will pass out urine. So there are different levels at which bedwetting is happening, from the brain to the bladder level to the sleeping arousal level and all that. So you should see a pediatrician. Usually, if you're in Nigeria, pediatric nephrologist will be best choice. So they will ask you all these questions so that we can figure out which level your child's bedwetting is happening. We will ask you to do some diary. We will let you know about also some things you give your children at night, things that we give children that irritates the bladder. So giving them milk, giving them caffeine, tea, and all those things at night, not good. It irritates the bladder, so it makes them to pee a lot and all that. So we ask you several questions, and then we begin to work out which one. But there are certain things we expect you to do as parents as well. We want the children to drink a lot of water when they're bedwetting. Yeah, we want them to drink a lot of water during the day so that they get used to their bladder being full. They get used to knowing how to go to the toilet and all that. And then we don't want you to be giving them things that will be irritating their bladder. So you want to take out milk, you want to take out caffeine, you want to take out all these juice and drinks and all those things. You want to take them out. You want them to have what we call regular bladder hygiene. So you help them to drink a lot during the day. So they need to take up to 6 to 8 glasses of water. So and sometimes children don't remember to drink. They don't drink at all. So you have to make sure you fill the bottle for him and make sure he finishes the bottle. Then he goes to use the toilet maybe every 3 hours. So you get used to having a good bladder hygiene, Then when it is bedtime, like no more liquid at all from 7 p.m. They should have the dinner early. By 7 p.m., no more liquid, no more drinks at all, and no more water, nothing from 7 p.m. Then let them go and pee before they go to sleep. Then if you go to bed later than your children, you can wake him up the second time. So we call it double voiding. Then you go and pee again. So that may be helpful. If your child is somebody who is a deep sleeper, you can buy, like on Amazon, we have what we call bedwetting alarms. They wear it in their pants and all that. So once the water starts to come out, it will vibrate or make an alarm, and then the child will wake up, and then the child will go to pee. So that is good for children who are deep sleepers. So the bedwetting alarms tend to wake them up, and they will remember to go and pee. So those are things you can do as parents. However, if you have done all that as a parent and the child is bedwetting, we may sometimes give them medication. So we give medication that reduce the amount of the diuretic hormone. So we give what we call desmopressin. It's kind of reduce the amount of the urine that the children will produce. So it's something we can give for children. Usually we give for the first 3 months, and actually it can cure some children of the bedwetting, and they'll become dry. For children who have a small bladder or their bladder is easily irritated, there are some other drugs that we can give. We can also take them through bladder training and all that. So I'm just trying to summarize how we normally manage bedwetting, but it's a medical condition. So don't be feeling like um, you need to embarrass your child and make them feel like. Of course, you can use reward as well to motivate the children. Tell them, any day they have dry nights, you get a star, and all that. And maybe when you get up to 5 stars or you get 7 stars, maybe you convert it to something. Maybe they have 30 minutes more on the tablet, or they get to buy something like a snack or something, just something to motivate the child to look forward to being dry and all that. But like I said, sometimes it's a medical issue and we can treat them with medication. So you may want to see a pediatrician who knows how to treat a child who is bedwetting, or a pediatric nephrologist. So I hope that's we have a whole article on bedwetting. You may want to check our website for that, or you can go to Eric UK website. There's a website, just search Eric UK. It talks a lot about bedwetting. It tells you all these things I've told you about, how to help your child get dry, bladder and bowel as well website. So just check bedwetting websites, tips for parents, things like that. You will see a lot of websites that are devoted to that. Try some of those strategies. If you've tried everything, then see your pediatrician and we can take it up from there. Okay. So, Princess Fatima, my baby of 6 months height is 56 centimeter. Is this okay? Yeah. 50. Who measure the? Usually for 6 months, we don't measure height. We measure length. So height is for a child who can stand. Length is for a child who cannot stand. So before we start worrying ourselves, I think you should make sure it is measured correctly by one of our nurses, not you, because there's a way we measure it, and I'm sure most parents won't get it correctly, because there's a way we measure from the head, and then we have to stretch the baby and get it to the legs and all that. So they have to use what we call infantometer to measure it properly. So let them check it properly for you. Usually most newborn babies measure 50 cm, and then by the time they're about 1 year old, they are 75 cm. So I'm not really sure whether this measurement is even correct to start with. So I would rather say just recheck it first, and then they will advise you what to do. Really, most time we don't do anything about height anyway. We'll just monitor it and see, and then we also need to monitor the parents' height, because height of children, length of children is more dependent on the parental height. So if the parents are short, the children will be short. If the parents are tall, the children will be tall. I mean, genetics, so there's nothing else to do about that. Oluchi, good day, doctors. Whenever water touches my baby's face, he'll start rubbing his eyes continuously. Yeah, that's irritating. So, please, what do I don't use soap to wash his face. So, I only clean with soap. Well, yeah, he rub his eyes. So, what do you put in the water? That's the issue. So is it just plain water, or do you add like Dettol or other antiseptics into the water? If you're adding things to the water, it may be irritating a child. So the most important thing is you can use the face towel to wipe the child's face, and then make sure you apply like Vaseline, hypoallergenic stuff, shea butter, to the face as well. So that's what, if you're adding any other thing else that could be irritating a child, you may want to stop that and see. And then for how long the child rub the face, would the child stop eventually, or does it keep rubbing the face for the whole day? I mean, it's not unusual for children to feel like what is on my face and all that, but it's not like you should continue rubbing their face for the rest of the day. I won't worry about that unless it's like persistent, then that will now be when it will be an issue. I hope that's helpful. Faith, Please, when is the best time to give birth to triplets? Okay, I'm a pediatrician. I'll leave that to the gynecologist. The gynecologist will tell you when they are going to deliver your baby. I don't think there's anything called best time. They monitor your babies and then they will decide when they are going to put you to bed and whether you're going to deliver normally or whether you're going to have cesarean section. There are lots of issues that go into decisions on delivery. So these are decisions you will take with your gynecologist obstetrician, not the pediatrician. So you should have that conversation with your obstetrician. There's nothing like a generic law that say, okay, oh, twins must be delivered at so months, triplets must be delivered at so. No, there's nothing like that. There's no law. We want all babies to be born at normal time. Okay, so but if there are other complications with the pregnancies and all that, then your obstetrician will tell you when they want to deliver the babies. And we always want to deliver the baby at the normal time. We don't want to deliver babies earlier than normal unless there are complications. So have that conversation with your obstetrician. I hope you are registered with one so that they will take it up with you. All right. Instagram people ask the questions. I'm checking. All right. The next question on Facebook, and Anike Joy. Good evening, dog. My baby is having rashes on her face. Okay. I met with the pediatrician. We give skinny hydrocortisone. It will clear and reoccur again. Yeah, you go back to the pediatrician for follow up. I'm not sure what your pediatrician is treating because that combination sounds very unusual. I doubt whether it's a pediatrician that gives you that combination of skinning and hydrocortisone. Very, very unlikely because skinning already has steroids and then giving you another steroids. And why are they giving you something that has antifungal, antibacterial steroids and steroid? So please be very careful who you see. It is not every doctor you see who is a pediatrician. Yeah, I know most time parents don't know that. If you are worried about your child's skin condition, I would recommend you ask to see a dermatologist. The dermatologist is the specialist when it comes to baby skincare. So I would recommend seeing a dermatologist. I'm not quite comfortable with that combination of skinny and hydrocortisone. And I wonder whether your baby was a baby born preterm because your baby's birth weight is 2.1, which is very small, which is low birth weight. But if your baby was born preterm, that is fine. At what age can I add sugar to my baby's pap? Your baby is 4 months. Your baby should not be on pap. Your baby should not be on pap at 4 months at all. So your baby on 4 months old should be on breast milk only. I see a lot of mothers asking this question, giving pap to 3 months old, giving pap to. Please, let's stop it. Okay, babies 0 to 6 months should be on milk. We want them to be on breast milk. That's what we recommend as pediatricians. And I know all of you, some of you have some 1001 reasons why you cannot do exclusive breastfeeding. Today is not a breastfeeding day, so I will not fight you today. If you're not going to breastfeed, then give them the formula that is age appropriate. Okay, so if you can't breastfeed, then give formula, give whatever formula you like, as long as it's for children less than for 0 to 6 months. Please don't give pap to 4 months old. Don't give pap to 3 months old. Pap and other solids should only be given from the age of 6 months. So please, and you are worried that your baby is having skin rashes, your child could actually be reacting to some of these things you are giving as well. Okay, because allergies can also come from food, which is one of the reasons we want you to exclusive breastfeed your babies. It's protect them from all these skin rashes, allergies, and stuff. So first 6 months of life, breast milk only. If you are not going to do exclusive breastfeeding for whatever reasons, give age appropriate formula only. And then from 6 months, that is when you will now start pap and other solids while you continue to breastfeed. There are reasons for these recommendations. We don't just make those rules or recommendations based on whether Dr. Gbemi just like people to suffer until their baby is 6 months before giving them pap. No, there are researches, there are evidences behind this. We don't have time to be to be going into that. I mean, you don't need that as a parent, that is for the scientists, but there are evidences based on all these recommendations. So we know that your baby's tummy is only ready, your baby's digestive system is only ready for solid from the age of 6 months. Trying to do it earlier is not helpful. Okay, try and just do things at the right time. It doesn't make your baby to be um bigger or better or anything. You're actually going to put that baby at risk of other issues. So please, breast milk only or second best formula until 6 months. From 6 months old, you continue to breastfeed while you now start giving pap and giving other things. Okay, so to know more about how to feed your babies, please go to the guide section on our Facebook group. Do the guide too on complementary feeding. We'll go into all these details. There's no problem you adding sugar or whatever to your baby's pap. If you can use other um other methods like dates, natural sweetness is better, but if you have pap, sugar is fine. Moderation, and of course pap is not the only food your baby will be taking from 6 months. Every other solid, your potato, your rice, your beans, it's all about all the vegetables, the fruits. There are multiple kind of food baby will eat. It's not just pap and cereals or milk only. So there's a lot to learn about complementary feeding. So it's not common for baby to ever take pap, because I know a lot of mothers who will ask us like, oh, my baby doesn't take pap, but eats normal food, as if pap is written into the constitution that babies must take pap. They don't have to take pap. As long as the child is eating food, solids, that is all the child needs to eat from 6 months. So if the child doesn't want pap, that's fine. It doesn't have to be pap. It has to be other food. It can be other food in other porridge, your yam porridge, your potato porridge, your even your fruits, and other cereals. All of them are acceptable, and all of mixing them in different proportion, making sure it's not just one particular food class, different food classes. All those will help. I hope that's helpful. I'm sorry if I'm too hard on you. I just want to make sure you're doing the right thing by your baby. Okay, there's a question on Instagram. Harasetina, good evening, doctor. Is it good that biscuits, bread, crisps, other sweet things increases ADHD and autism in children? Okay, number one, none of those food causes autism or ADHD. So let's just sort it. Bread or taking sugar is not going to cause ADHD. Neither is it going to cause autism in children. That is number one. However, having said that, children who are ADHD are hyperactive. So when you give them things like sugar, things that have a lot of, that's going to release a lot of sugar into the blood, they are going to be more hyper. So definitely it's better to stay off sugar and all those junk food generally in children, whether they have ADHD or autism or not. It's better to stay off junk food in children, give them healthy fruits and as their snacks instead of biscuits and crisps and all that. That is number one. The same thing with autism. Some parents are finding that their children do better in terms of their behavior and all that when they take them off gluten containing food. Most of those things you mentioned, biscuits, bread, crisps, they are all loaded with gluten. So some parents are finding that it's up. So the gluten or the sugar is not the cause of the autism, neither is it the cause of the ADHD. But children definitely do better without junk food. And your children don't even need to have ADHD or autism for you to stay off junk food. So if you go to that guide section I was talking about, we also have a section on it that talks about what's not to give your children. In addition to tell you what to give your children, we actually tell you what not to give. And all these things you really said are the what's not to give. So all these junk food, really, we want you to stay off them. Give your children more fruits and healthy option. That's better for everybody, whether they have autism or not. So I hope that's helpful. All right. Oh, Akindele, you've been to the GP concerning the bedwetting, couldn't see anything. So your GP can refer you to the bedwetting nurses. If you're in the UK, you should be referred to the, depending on who does it in your It's your own head board, whatever. Some have what we call bedwetting nurses, bladder and bowel nurses. They will do that. School, some do it. School nurses do it. Some is a community pediatrician that do the bedwetting. So they can refer your child for those treatments I mentioned. So just let them refer the child. That need to be okay. Princess Amasiga, my twin boy, 1 year 9 months, are yet to talk. Were they preterms? Let us know. If they are not preterms, 1 year 9 months should have at least single words. They should be saying single words. So you may want to see the speech therapist, and then they will be able to do that. Olayinka, hearing this for the first time, bedwetting alarm. Oh yes, we have bedwetting alarms. There are different type of them, and you can buy it yourself. You don't need a prescription from a doctor. They are available on Amazon. There are many of them. Not all of them are expensive. They are bedwetting alarms. Very, very many of them. Olufunke, well done, ma. Thank you. Okay. Benedicta, my daughter of 3 months had eczema. Okay, so actually I don't take parents' diagnosis. Okay, parents will call any rash. You can call it eczema, whatever. It doesn't necessarily mean it's an eczema because if you tell me eczema as a pediatrician, there's what I think of. I'm thinking of atopic eczema, atopic dermatitis. It may not necessarily be that, but I understand you because people around you may have also called it eczema. But that doesn't mean that is what a doctor will call it. So that is why we always like to see rashes first. We need to see. We need to see before we can make up our mind what is the cause of that rash, and then it's the treatment of rashes is the cause. So it depends on the cause of the rash. There are some rashes we don't even treat. We just tell you leave it alone. It's going to go by itself. There are some rashes we just tell you maybe it is the cream or the soap or the powder or whatever you are using, just stop it and the rashes will just naturally clear. Some rashes is you just need to use moisturize your baby's skin, maybe it's the dryness of the skin and all that. So some rashes are due to bacterial infection, we need to give antibiotics. Some are due to fungal, we need to give antifungal. Some are due to allergies. Those are the ones that sometimes we use steroids and sometimes we have to figure out what is it that the child is reacting to. Maybe it's a soap you are using to even wash their clothes. You need to change it to something more hypoallergenic and all that. So it is very important. And I see a lot of mothers always they say rush, and I see them on my Facebook group. Even when we're trying to answer questions, they are always rushing and telling them, go and buy this, go and buy that. Oh, go and buy Tributon, go and buy that. No. So Tributon, pseudo cream, they are not treatments for skin rashes. Okay, so apologies to those of you that have been kind of brainwashed by those companies because they make you feel like those products take care of all rashes. That is not true. Okay, pseudo cream is just a anti-nappy kind of cream. It's a nappy cream. It's to make sure that the nappy area is moisturized and it doesn't, there's no irritation by the urine and all that. It's not a treatment for skin rashes. The same thing with Tributon. So don't just start using something. Sometimes it's better to just leave it alone and then ask your doctors, your nurses, or ask us on Ask the Pediatrician. Then we can tell you what to do. And then we always tell you how to do proper skincare. All this nice, sweet smelling, lovely stuff that we buy in the market for our babies. Most of them are actually very wrong for us to use for the babies. Honestly, babies that have sensitive skin, all those lovely, sweet smelling baby products, they're not good for them because they are loaded with chemicals. And it's those chemicals that are irritating those baby's skin. And sometimes just staying away from those chemicals alone, all your baby skin rashes will go away. So we want you to use things that don't have all these chemicals. So you want to go for what is hypoallergenic. You want to go for natural stuff. Use your ori, shea butter, use your olive oil, use your Vaseline, Blue Seal without perfume, use your coconut oil. Those are better for your baby's skin than all these nice, expensive, sweet smelling stuff that people buy. No powder. Stop using powder on the baby's skin. It just dries their skin. They don't need that. The soap, use normal tablets, soap, not all these antiseptic medicated. So babies don't need all of that. So just go for as natural, as little chemical as possible. And some of us are now beginning to give babies deodorants and cologne. Come on, we are trying to run away from all these chemicals. Baby skins are so sensitive. They are just, getting used to all these things. And when you put all these chemicals on them, they react to them. And that is why they have all these rashes. So we want to clear away most of those things. Go for your black soap, it's better. Your ori, your olive oil, your Vaseline, they are better than all these other nice stuff that smells so nice, but they are loaded with chemicals. But some babies, despite doing all the right things, their skin is still so extremely sensitive and they may need some treatment. That's where your pediatrician and your dermatologist come in. Please see us first before you start buying whatever people recommend for you, because at the end of the day, you can actually make things worse, doing the wrong thing. So don't do that. So Benedicta, you have to take a picture, share it with us on our Facebook group, or see one of my colleagues in the hospital so that they can advise you on what to do in terms of the skin. So I'm just giving generic advice, which sometimes take care of all these problems. All right, Funke saying my 14-year-old has started I guess you mean okay, menstrual cycle in May, September, October, it didn't come. That is perfectly normal. So when children start their cycle, for the teenagers, the first few years is usually irregular. It does not mean they are pregnant. This is perfectly normal for them not to, they may see one and may not see it for another 6 months. We are not worried about it. It is expected. And we don't bother about it. So just make sure you teach them hygiene, changing your pads and all that. Of course, we expect that you have done all your sexuality education from age of 2 years, 18 months to be precise. So they know what not to do, what to do, and all that kind of thing. So, but irregular cycle is absolutely normal for teenagers when they are starting the period. It's absolutely nothing to worry about. Sometimes the period may be very heavy, sometimes it may be very light. It's just going to be up and down, because most of their cycles is what we call anovulatory cycles. They are not yet releasing eggs per se, so it makes it kind of up and down. But eventually, within 2 years, it will now become more standard and regular. So that is it. Otherwise, it's nothing to worry about. Okay. Queenette, sorry. My daughter of 5 months had cough. I was asked not to give her cough syrup. Yes, please don't. Does it have any effect? What do you mean, does it have any effect? You mean that if you give her the cough syrup, why don't you want you to give her the cough syrup? So we don't want you to give cough syrup because cough syrup is not the treatment for cough. Okay, I know that sounds very, how do I put this? Maybe it may sound like contradictory, but when children are coughing, we are not worried about the cough. Cough is a normal reflex. Everybody coughs. When you cough, you are trying to clear your airway. So that tells us that something is irritating the airway. We are more interested in what is causing the cough than the cough itself. So the cough is actually telling us something. So, and children don't cough out. They actually swallow the sputum. So most cough syrup are expectorant. So it is relevant in children who don't cough out. They actually swallow. So what are you bringing out when so most of the cough syrup are meant to make children to cough out something, but the children don't cough out anything, actually the infants below the age of 1. So there's no need for them to take cough syrup. And then some of those cough syrup are actually the ingredients in them make it they are meant to sedate. They kind of make you feel sleepy. I'm sure most of you are aware of that already. We don't want children to be sedated when they are coughing. We want them to cough, because when they keep coughing, we know there's something going on, and children need to breathe. So, but when you sedate them with the cough syrup, then they stop breathing, and they can die from that. So we don't want their respiration to be suppressed or to be reduced. So cough syrup is not clearing what is causing the cough. On the other hand, it can cause serious problem. It can sedate the children, it can reduce their respiration and all that, causing more serious problem. So cough is not the problem. Leave the cough alone. What we want to know is, why is the child coughing? Most children in this age group, if they're just coughing, no fever, no breathing fast, it is mostly a viral infection, which you don't need to do anything about. It's going to go by itself. 1 or 2 weeks, they will clear. Just leave it alone. Most important thing is to keep them away from the people who are coughing. Keep them away from adults who are coughing, smoking, all the smokes, all those irritation. Keep them away from that. That's all. Keep breastfeeding them, and that's all they need. But if the child is coughing, he's having fever, is having fast breathing, then that is telling us that the child may have pneumonia. That is, and pneumonia is one of the killer in children. So, which is why we don't want you to suppress the cough. We want to know that the child is still coughing so that we will know what is going on. So, if the child is coughing and is breathing fast or is having difficulty with breathing and having high fever, you have to take them to the hospital because that's most likely pneumonia, and the child has to be treated with antibiotics. So, the focus for us as pediatricians is treating what is making a child to cough, not suppressing the cough. So we don't, especially for children who cannot talk below the age of 2, we don't want them on cough syrup at all. We don't want anything suppressing their respiration. We don't want anything making them drowsy. We don't want any of those. Of course, the older children, when they are coughing and they're able to talk, they can tell us, oh, my chest is paining me, and all those kind of things. So we know. And when things are going well, they can tell you. So we know. So for those ones, we don't worry so much about the cough syrup. But for the younger ones, even they don't really need it, to be honest. But for the younger ones, we don't want them on cough syrup. So that's why we always want you to stay away from it. Okay, so your babies were preterms. That's Princess. Okay. Oh, question again. So for your preterm babies, you need to correct their age. So you have to tell us how preterm they were so that we can correct their age. And when we correct their age, then we'll know whether we should worry about their talking or not. But like I said, 1 year old, they should have a single word. Most speech therapists will not worry so much, but if by 2 years they are not talking, you have to see the speech therapist. All right, its time is up, but I quickly want to finish the last few questions. I hope nobody has any question on Instagram that I missed. If I did, it's apologies. Please repost it and I'll answer it in the last 1 minute I have. Olayinka said, my baby, 13 months old, born 2.9 kilo, 11 kilos, have something like nausea when clapping his hand mostly. What is nausea? So what do you mean the child has nausea? The child is not vomiting but has nausea when clapping his hands. So I'm trying to picture it in my mind and I'm still trying. I'm not sure I'm coming up with anything significant. I actually don't know what it is. So, but in medicine, if you know what is causing something, then you stop it. So if you think it's the child clapping his hands that make him to feel nauseated, which I'm still trying to see what's the link between clapping hands and getting nauseated, I would just tell the child not to clap his hands then and watch. But I usually don't think there's any link between the two, and I'm not really sure what you are describing as nausea is nausea itself, because you have to tell me exactly what the child does that you are calling something like nausea. I really need to know what is exactly the child doing that you are calling nausea. So because since the child is not vomiting, I don't think that is nausea. But I really want to know what exactly the child does that makes you think okay, make a sound. Okay, he keep giving the sound like vomit wants to come. Is it hiccuping or is it I don't know. Anyway, I would just say that's very unusual. I hope it's not also something the child is doing as a form of a game, because the fact that the child does it only at a certain time also will make it sound unusual. Usually children who have nausea and all that, they don't predict it. So it won't happen only when they clap their hands. It will happen throughout the whole day if something is actually making them nauseated. So they won't be nauseated only at a particular time of the day or when they are doing a particular something, unless maybe the smell of food or smell of something. So that's what we kindly associate. That's the kind of thing we will associate with nausea, but not a child just clapping and then making those sounds. Are you sure the child is not just doing the sound as his own way of maybe you think you should go with the clapping? Just watch it for now. For me personally, I won't really worry about it. I don't think there's anything, to be honest. But like I said, watch it. If it keeps happening, then you can see one of my colleagues in the hospital and then they can help you the more. All right, so thank you so much, everyone. It's been a wonderful time talking to you all. Maybe on Thursday, I will try and do a teaching on prematurity, because we celebrate World Prematurity day yesterday. We see having a lot of our children born small, and children that are born small, they constitute 25% of all our newborn deaths. So newborn constitutes 25% of all under one deaths. It's really a lot of statistics. But basically, when we talk about children dying too young, the premature babies, they are the number one risk factors for us losing our babies. So we don't want babies born too small. And the reason why we have our babies born too small, since I'm talking to mothers today, is because some of us, we 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 put ourselves at that risk. Okay, in the last few months, in fact almost every month, I answer several questions about mothers who just had babies and they're telling me they're pregnant again, and they make it sound as if it is an accident. Oh, I just discovered I'm pregnant. I have a 6 month old baby. I just discovered I'm pregnant. Oh, I just had a cesarean section and I just discovered I'm pregnant. No, you don't just discover you're pregnant. You are pregnant. Every pregnancy is intentional, whether you want to admit it or not. Okay, because as long as you are a woman of reproductive age and you're having unprotected sex, you're going to get pregnant. Whether you just had a baby yesterday or not, you're going to get pregnant. Okay. So if there's any message I'm going to leave today, is that I don't want to answer those kind of questions again. If you have just had a baby, please do family planning. Do family planning. I know some of you are going to say, oh, family planning fails. 99% of you asking those questions, you did not do family planning. I'm so sure of it. You did not. You were just hopeful that you were still breastfeeding and you were going to count your maybe because you have not seen your periods and you're just going to do it only once in 3 months or 6 months. Doesn't really matter. That one is enough to get you pregnant again. The reason why I'm saying is that when you have a baby so soon, so close, too frequently, you are likely going to put your risk as having high risk babies. Those high risk babies are the babies that we tend to have them born too early. And when they are born too early, there are lots of challenges and complications that this baby can have. Of course, there are other reasons for prematurity, but I'm trying to talk about the ones that we all can do something about. And that is making sure that we space our babies at least 2 years. Let's space them. Once you go for your 6 weeks postpartum check, please do your family planning, whether it's injection, whether it's IUCD, whether it's implants. Do whatever you need to do. Just do it. Most of us cannot do tablets because we always forget to take the tablets, and it's not helpful. You have to take your tablets every day. But the injections is every 3 months. So you just need 4 injections in a year, or the implant is there. You can be there for 2 years, 3 years, it's not bothering you. Or the IUCD can be there for 5 years, it's not bothering you. You can take it out. And please don't be scared that you won't have your baby when you want to have your baby. It's not true. Once you take off your family planning, your fertility returns. Okay. So some people say, oh, I take off my family planning and then I don't get pregnant again. It is not the family planning. There are people also who did not do family planning and they didn't get pregnant again so quickly. So there's a concept of secondary infertility. It has nothing to do with family planning. So please let us space our children. Let's register for antenatal care. I see a lot of mothers, 12 weeks, 13 weeks. Please don't be too confident. Actually, my mothers that have had 1 or 2 babies, you become experienced mothers, super power mothers. Please, every pregnancy is different. So please register for antenatal care. And antenatal care is not dancing and singing. I love this dancing and singing, but please let them make sure they are checking your blood pressure, they are checking your blood sugar, your urine, making sure there's no infection, making sure you are okay. I'm monitoring you. And if you notice anything in pregnancy, please quickly let your doctors know. And please don't take all this agbo, all these drugs. When you're pregnant, don't take any drugs, and so that at least you'll be protected from all these congenital malformations and all that. If you have had a preterm baby before, please register with the obstetrician, with the specialist, because sometimes they may need to do what we call sacrilege. They may want to suture your womb, the neck of the womb, so that your baby will stay long as possible before coming out. And please register if you are prone to having preterm. Maybe register with obstetricians and hospitals that have pediatricians. We have to be there when baby is born. No matter what we do, some babies will still be born early. But if we are there and we take care of the babies on time, we will limit the long-term complications for the future. So we want to reduce prematurity by all means, because when we reduce prematurity, our babies dying from prematurity will also be less. That means the number of babies dying will be less overall, because prematurity is one of the top causes of our newborn deaths, and we want to reduce that by all means. So I hope I've been able to pass the message across, but I think I'll come back on Thursday and do a whole teaching on prematurity again, remind us of what we already know on how to reduce this issue of prematurity. And for our preterm babies that have survived, congratulations. And then we hope that we will be able to reduce prematurity with time. Thank you so much for listening to me. If you still have any questions or you are just coming online and I'm leaving right now, please go to Ask the Pediatrician Facebook group. You can't miss our Facebook group. Go there, drop your questions there, and we will try our best to answer your questions. You can drop your question anytime, Monday to Saturdays, 24 hours daily. We will answer your questions and do our best to direct you to if you need to go to hospital as well. So thank you so much for joining me today. Watch out for ATP Hour on Thursday, hopefully, and then we will talk more about prematurity and maybe pneumonia as well. Have a wonderful, wonderful evening, and it is bye-bye from me. Bye-bye, everyone. Bye.